Ever pondered the significance of coronal access in endodontics? The journey to understanding this crucial element begins with the 3 essential steps to successful endodontic treatment: coronal access, chemo-mechanical preparation, and obturation. Coronal access specifically refers to the preparation of the cavity by removing the coronal portion to access the pulp chamber. Its importance cannot be overstated, as errors could render the canal inoperable. Unwanted remnants of the pulp chamber's roof could darken the tooth crown. Furthermore, failure to locate the canals can lead to persistent endodontic disease. Several factors contribute to endodontic failures, including diagnostic errors and inadequate treatment planning. Lack of familiarity with pulp cavity anatomy is another common culprit. Therefore, practical training on extracted human teeth and a strong emphasis on biosafety and the proper use of protective equipment are recommended for beginners. Before coronal access, a thorough clinical examination and periapical radiographs are essential. Periapical radiographs using the parallel technique can aid in planning the access. Factors such as tooth inclination, caries, pulp horn locations, and calcifications play significant roles. Before the coronal access, several prerequisites must be met. Check the tooth and root inclination in the dental arch, remove any decayed dentin or restorations that may hinder access, smooth sharp surfaces to facilitate absolute isolation, and remove any inclined planes of the crown that could interfere with external references. The operational steps to access the pulp chamber include establishing the preferred area and initial contour shape, removing the remaining roof wall, and preparing the side walls. Spherical drills and trunk cone diamond drills can be instrumental. For form convenience, diamond or ultrasonic drills can be used to conform to the pulp cavity. Cleaning and antisepsis of the cavity involve removing decayed tissue, bacterial plaque, and antiseptics with sodium hypochlorite solution. Access surgery involves direct access to the cement dentin limit, direct visualization of canal entrances, removal of the pulp chamber's roof, and facilitating the use of instruments and removal of tissue remnants. The operational sequence includes radiographic planning and clinical examination, establishing the preferred area, contour shape, trephination direction, and cleaning and antisepsis of the cavity. The contour shape varies depending on the tooth. For instance, upper and lower central and lateral incisors have a triangular shape, with the base towards the incisal and the vertex towards the cingulum. Upper canines have a spear shape, with the smaller tip towards the cervical. Upper premolars have an elliptical shape in the central fossa, while lower premolars have an oval shape in the central fossa. Upper molars have a trapezoidal shape with the larger base towards the buccal face in the mesial fossa of the occlusal surface. Lower molars also have a trapezoidal shape but with a larger base towards the mesial face in the mesial fossa of the occlusal surface. The operational steps of coronal opening involve the election point where the opening is started, trephination direction towards the area of the pulp chamber with the most volume, contour shape projecting the tooth's anatomy, convenient shape for a better internal view of the pulp chamber, specific election point for each tooth, and trephination direction creating a penetration tunnel. Remember, understanding and mastering coronal access is the key to successful endodontic treatment. It's a journey of precision, patience, and practice. Always stay curious and keep learning.